is that we have very significant benefits from the use in certain patients and for certain tumors, certainly. And there's always been a concern that there is an under reimbursement for SRT. And the American Cutaneous Oncology Society has been fighting very hard for the last few years with CMS. And this year we were very happily surprised that they've listened to us. There's a 76% increase in reimbursement for the main code that we use for radiation therapy, which is 77401. So that's very significant. And we've had for the last few years the ability, and in fact, they've said we should be using E&M codes. And the reason we use E&M codes is that the 77401 includes nothing when it comes to evaluating either the history of the patient nor the lesion itself to determine whether or not we should continue radiation therapy. What we do for each treatment is have a history, whether the patient is having any problems, pain, irritation, etc. What have they been putting on anything? Have they been compliant? And then we do an examination to look for things such as ulceration, radiation dermatitis, and there are different forms of radiation dermatitis, obviously, in the acute phase, different levels, and then make a determination from there of whether or not we're going to treat on that day and future days or hold off of radiation therapy. And based on the new guidelines with evaluation and management codes, early on, if there is erythema and ulceration, that's considered an acute illness from that perspective, and you'll make a determination, and that would equate to a 99213. And then as patients develop radiation dermatitis, and radiation dermatitis clearly in looking at the skin is very different than radiation dermatitis if you're treating something such as breast cancer where it's really just a side effect. The radiation dermatitis is being concentrated in and around the tumor, and it's important because we utilize this as a proxy of whether or not we'll continue treatment. So radiation dermatitis is a chronic dermatitis. It has an acute phase, but it always has a chronic phase. And what we're doing in terms of the ultimate benefit to the patient is we're trying to limit the long-term consequences, that being the chronic phase, as much as possible. And that's this therapeutic index. So what we're doing is we're having an exacerbation of a chronic dermatitis, in this case radiation dermatitis, and we're making a determination of whether or not we're going to do radiation treatment, which is akin to making a determination of minor surgery. It has nothing to do with the tumor. It has to do with the surrounding areas of radiation dermatitis in this case. And in doing that, that would equate to a 99214. And I think that, what has been very clear is that, the determination that we have has to do with the degree of radiation dermatitis in the area, perhaps the degree of ulceration of the area, whether it's what grade, and we have to decide whether or not to do treatment or to hold off on that day. And that's really where the specific documentation is for 99214. Absolutely, because we have to evaluate the patient on every visit. Now, early on, we may not see radiation dermatitis, and it just may be, erythema in the area. It just may be making sure the patient is having no acute problems from this. So it will be a lower visit code, maybe a 99213. But for each time you're taking a history, is the patient doing okay? Are they having any issues? We're evaluating the lesion and the area itself and making that determination.
Today, nearly 5 million people in the United States are treated for skin cancer, with 4 million new cases of non-melanoma skin cancer diagnosed each year. There are nearly 18 million people affected by keloid scarring. Sensus Healthcare is dedicated to improving the lives of those people. We believe every patient deserves a choice. That is why we offer superficial radiation therapy with the SRT-100. SRT is a painless, safe, and highly effective non-surgical skin cancer and keloid removal treatment. With clinically proven technology that has been used for more than 50 years, the SRT-100 delivers a precise, calibrated dose of superficial radiation therapy that only goes skin deep. This low dose of radiation safely destroys non-melanoma skin cancer and keloid-forming cells without destroying healthy tissue. Performed right in the doctor's office, superficial radiation therapy with the SRT-100 delivers results without the negative side effects of invasive treatments. Along with excellent cure rates that rival surgery, patients and physicians enjoy many advantages when they choose the SRT-100 as their treatment of choice.
We've been using SRT-100 for about 4.5 years now, and we're very excited to have that in our practice. SRT-100 is the ability to use X-ray to treat a skin cancer, which is just superficial on the skin. It's very safe and it's easy to use.
Treatment with the Sensus SRT-100 is done right in our office. As with any radiation treatment, there are multiple treatments required.
The benefit of having the SRT-100 is that you as the doctor really control you orchestrate the whole show. You know exactly when you're going to have the surgery performed. It is short. It only takes about 10 to 15 minutes per treatment. They have to come back 1 to 3 times after the surgery, and it's painless.
The photon X-ray technology that we have with the SRT is better known as tissue preserving technology. So it doesn't destroy all the tissue around, all the healthy tissue. It only attacks the tissue that needs to be attacked and needs to be eradicated from that portion of the skin.
And there was no pain at all. I didn't feel anything.
The SRT treatment today was kind of interesting. I didn't feel a thing, actually. It was very okay. It was very comfortable, and I didn't feel funny at all.
The SRT-100 is most useful for non-melanoma skin cancers. Those are basal cells and squamous cells, and those are first diagnosed by your dermatologist and then best treated by a dermatologist.
Overall, the Sensus SRT-100 is a highly effective treatment option for basal cell and squamous cell skin cancer, especially for those people who don't want to have surgery or can't have surgery.
For nearly 18 million people afflicted by unsightly, sometimes painful keloids, removal can be elusive. In fact, nearly 7 million sufferers don't even know keloid removal is available. Sensus Healthcare is dedicated to improving the lives of those people. We believe every patient deserves a choice. That is why we offer superficial radiation therapy with the SRT-100. A painless, safe, and highly effective keloid treatment when surgical keloid removal is followed by superficial radiation therapy. Recurrence drops to as low as 10% and often 0%. With clinically proven technology that has been used for more than 50 years, the SRT-100 delivers a precise, calibrated dose of superficial radiation therapy that only goes skin deep. This low dose of radiation safely destroys the cells that form keloids without destroying healthy tissue, keeping the skin smooth as the incision heals. Performed right in the doctor's office, superficial radiation therapy with the SRT-100 delivers results without the negative side effects of invasive treatments, and it only takes a few minutes. A precise, pain-free treatment for keloids, the SRT-100 is giving countless keloid sufferers new hope and confidence.
I know it looks ugly, but that's just keloids.
I've had the keloids for, I would say maybe about 3-4 years at this point. I don't know how they came about, they just began to grow.
I had my keloid since May 17th, 2013. On that day, I actually got hit by a car, and when I landed in the car, it formed a keloid.
Since we've had the SRT 100, we have literally had 100% success rate in not having them recur. And the nice thing about it is that we can use this device in our office.
All the existing kind of standard treatments for keloids up until SRT have had a fairly low success rate. In other words, you can remove the keloid, but the chance of it coming back is fairly high. Your success rate might be somewhere between 30 and 50% with any of those procedures. So the nice thing about the SRT is that we remove this keloid surgically, and then we give the SRT right after that. And it's just a few treatments that they need, and it reduces their risk of recurrence significantly.
We want to provide really the message of hope to the people that they don't have to live with their keloids. There is a solution now that will ensure that these keloids don't appear. The success rate with SRT in conjunction with the surgical procedure has been quite remarkable. We're seeing success rates in excess of 90%.
The level of satisfaction is just sky high with these people because they've just suffered with it for so long, and they've been kind of told that, hey, this is the best we can do, and now all of a sudden here's this new technique, this new technology that gives them a very good cure rate, well worth any downtime from the surgery of removing the keloid.
The SRT 100, it was actually painless, the procedure with the machine going and everything like that, so I didn't see that as any additional complication, if you will, to any post-treatment.
The SRT 100 went extremely well today, and there was no pain at all. I didn't feel anything.
The SRT treatment today was kind of interesting. I didn't feel a thing, actually.
The SRT 100 has given us a vehicle to affect the cure and to affect a change in these people's lives for the better.
Each year in the U.S., over 5 million cases of non-melanoma skin cancer are treated. There are nearly 18 million people afflicted by keloid scarring, the vast majority being people of color, including Blacks, Hispanics, and Asian populations. Sensus Healthcare is dedicated to improving lives by treating these conditions in a manner that is safe, painless, and has aesthetically pleasing results. Along with excellent cure rates that rival surgery, patients and physicians enjoy many advantages when they choose the SRT 100 as their treatment of choice. SRT 100's clinically proven, FDA-cleared technology has been used for more than 50 years and delivers a precise, calibrated dose of radiation that only goes skin deep. This low dose of radiation safely destroys non-melanoma skin cancer and keloid-forming cells without destroying healthy tissue. Because there is no cutting or bleeding involved, SRT 100 is a great option for patients who are not good surgical candidates. To find out how SRT 100 provides you with options, check us out at sensushealthcare.com today.